Hi all, welcome to a new video. This video is about photodynamic therapy. In this video, we'll be discussing about the basics of photodynamic therapy, the steps involved in the therapy, and then the classification based on the photochemical reaction going on in the cell. And then we'll see the important aspects of photosensitizers that are used and some of the examples of the photosensitizers. Okay, so let us begin. Photodynamic therapy is a kind of light activated therapy that is used in cancer patients. Okay, in this therapy we are using light to activate a chemical known as the photosensitizer or a photodynamic therapy drug known as the PDT drug, so that the photochemical reaction resulting will cause the eventual death of the cancerous cells. We are administering a drug known as the photosensitizer to the patients, and then we use light to activate those chemicals so that the resulting photochemical reactions will lead to the death of the cancerous cells. This therapy is known as the photodynamic therapy. So this chemical agent known as the photosensitizers can be either administered through the circulatory system, that is by injecting the drug, or in the case of skin cancers it is being applied topically, that is over the skin we can apply the sensitizers. The photosensitizers or the PDT drugs are having more affinity towards the malignant cells or the cancerous cells. Even though we are administering this drug to both normal cells and the cancerous cells, the amount of time for which this is retained in the cell is much more for the malignant cells. That means after applying the drug, we'll wait for a certain amount of time. It may range from few hours to a few days. After this period of time, when we observe, we see that the amount of the drug retained in normal cells are significantly reduced, but it will be retained in the tumor cells or the malignant cells. This is what is known by the greater affinity of PDT drug towards the tumor cells. Okay, so after the waiting period, when we apply the light, it will be affecting only the tumor cells because the drug is no more retained in the normal cells. So then when we apply the light, there will be certain photochemical reactions in the malignant cells in which there are the photosensitizers. So that will lead to the destruction of the tumor, and these photochemical reactions are non-thermal, and therefore there won't be any heating and all, and it will not damage the surrounding normal cells. So the PDT process can be summarized as: first step is administering the drug. That can be done either through the circulatory system, that is intravenously by injection, or by over the skin, that is topically in the case of skin cancers and all. And after applying the drug, we'll wait for a certain period of time so that it will be retained only in the tumor cells after the waiting period, and then we'll apply the light of a particular wavelength to activate the photosensitizers, and that wavelength and all will be depending on the type of photosensitizers used. So depending on the characteristics, we'll use any particular wavelength of light, and this light will be absorbed by the PDT drug, and there'll be photochemical reactions which will destroy the cancer cells. And after the process, we have to clear the remaining drug, otherwise that might cause some irritability when they are exposed to sunlight and all. So in order to avoid that, we have to clear the drug after the process. Now in the recent studies, some tumor targeting agents are also being used with the PDT drug, so that we can selectively administer the PDT drug to the malignant cells, and that will significantly reduce the waiting period after the application of the drug. Now about the light source being used, it can be either a lamp or a laser beam depending on the application site. If we are applying to some internal organ, we have to apply it by some non-invasive technique, that is some fiber optic delivery system, endoscopic system will be used, and in that case a laser beam will be appropriate so that you can directionally deliver it. And if it is a superficial cancer, then lamp type lighting can also be used if the coherence property is not needed. but usually in order to achieve certain required power density at specific wavelengths and all, laser beams will be appropriate. So mostly it is a laser beam that is used as the light source. Now let us come into the details of the photochemical reaction. When light is applied onto the photosensitizer, it gets activated and move on to an excited singlet state. And from there, it is a very short lifespan state. So from there, it will return to a triplet state, which is having a much more longer lifespan. And this triplet state of the photosensitizer will commence the reaction. So depending on the type of reactions, there can be two types of process, which is given as type 1 and type 2 process. So in the type 1 process, the triplet state of the photosensitizer will combine with the water molecule in order to produce some peroxides or free radicals, which will eventually lead to the destruction of the tumor cells. In the type 2 process, the triplet state of the photosensitizer will combine with the oxygen molecules to form singlet state oxygen, which is again a higher reactive phase, a high reactive state of oxygen, and that will again lead to the oxidization of the cells and thereby the cell destruction. So this is also a photooxidation process where the reactive species of oxygen will oxidize the cells and will lead to the cell destruction. So thus there can be two processes, either type 1 or type 2, and type 2 is the most commonly used type of process. That is, the oxygen molecules will be reacted to form singlet state oxygen, which will again lead, which are high reactive species, that will lead to the oxidization of the cells and thus the destruction of the tumor cells. The generation of singlet oxygen by an excited PDT photosensitizers can be observed either spectroscopically or with the help of chemical techniques. In the spectroscopic method, it is done by observing the phosphorescence emission happening at 1290 nanometer when the excited singlet state oxygen returns to the triplet ground state. And in the chemical method, it is done with the help of some singlet oxygen quenchers such as ADPA, that is anthracene dipropanoic acid. Now we'll discuss the properties needed for a photosensitizer. First of all, it should have the ability to selectively accumulate in the cancerous cells. That means they should be retained in the cancerous cells for a longer period of time compared to the normal cells. That is the most important characteristics. Then the next thing is it should be amphiphilic. That means it should be both hydrophobic and hydrophilic in nature. The hydrophobic characteristic is important for the cell membrane penetration and all, but at the same time, if the drug is injected into the bloodstream, it should be at least partially water soluble, and for that it has to be hydrophilic. So combining both the characteristic, it becomes amphiphilic in nature. Then significant absorption at wavelength at which there is maximum transparency to the biological tissue. That means the PDT sensitizer is actually activated at a particular wavelength, and that wavelength should also correspond to the wavelength at which the biological tissues provide maximum transparency. That means the light source should provide light at a particular wavelength so that the PDT drug is activated as well. It promotes a deeper penetration to the cells. Okay. At certain wavelength, the penetration depth will be very less. So if that is the case, then we don't get enough energy to activate the drug. So deeper penetration as well as activation should be possible at the same wavelength. And the next property is it should have a minimum toxicity. Then only we can ensure minimum side effects. Another thing is it should have high quantum yield and long lifespan for that triplet state. That is done to ensure the efficiency of the process. Also, the photosensitizer should not aggregate. That again is done for better efficiency of the process. Then it should be able to be rapidly excreted from the body. The drug after the treatment should be eliminated from the body easily. Now these are some of the examples of photosensitizers used. The first kind is porphyrin derivatives. That is mainly those are the derivatives of hematoporphyrins, and one such popular derivative is photophyrin, which is derived from hematoporphyrins with the treatment of acids. And the activating wavelength of light for photophyrin is about 630 nanometer, and at this wavelength the penetration depth possible is only 1 to 2 millimeters, due to which this kind of sensitizers cannot be used for tumors which are extending for more than 4 millimeters from the source of illumination. And also photophrins are having a disadvantage that they are sometimes retained in the skin for longer period of time, maybe about 4 to 6 weeks after the treatment. It might be retained in the skin, due to which the patient might experience some photosensitivity. So these are the disadvantages of photophrins. Now there can be another kind of photosensitizers. They are also derivatives of hematoporphyrins, like chlorins or bacteriochlorins. They are having a higher wavelength than that of photophrins for excitation. Then there is ALA, that is 5-amino levulinic acid, and these are some of the examples of the photosensitizers used in. Now coming to the application, these are some of the examples where we are applying PDT therapy, that is in the treatment of cancer, cardiovascular diseases, autoimmune diseases, chronic skin diseases, endometriosis, and in anti-cancer vaccinations and precancerous conditions. So that's all about the basics of photodynamic therapy. Thank you.